Hey everybody, sorry about tonight's 12 Minutes to Health not being done live. We were having some connection issues between Zoom and Facebook. It was just coming up an error each time, so didn't work out, but gonna go ahead and still do the same talk, and we'll get this posted on there so you guys can check it out and give us some feedback and like it and share it and do all that stuff. We still have some people in the offices too. Hopefully they'll get to see this tonight. They'll get to enjoy their refreshments, and you can ask the doc some questions as well. But as always, join us on Tuesday night. Get in there and get your questions answered and learn a little bit more about health and learn a bit more about the office and what we do and what our process is. So no commitment, free refreshments. Just come on in and enjoy yourself for the evening. We start every night at 6. Usually it's on Facebook Live, but tonight it won't be. Tonight we're going to look at an research article that has to do with kids who face abuse or mental abuse, physical abuse, those types of things, and how that affects their health later in life. Do they develop more chronic disease because of that? Do they develop worse lifestyle choices, things of that nature? So I'm going to share my screen with you here real quick, and we'll get started there. So as always, this research article tonight is based off of us reading through it and finding the best research for you. We always provide you with the peer-reviewed, randomized, controlled research out there. So it's not our opinion, it's the facts. Sometimes I will put my opinion into things and talk to you about it, but I always let you know when it becomes my opinion and not fact anymore. So this allows us to give you an unbiased, evidence-based approach to health and becoming healthier, and just knowing what the research truly says out there and how we can use it to benefit us and our health. So looking at that, tonight's article is done by Felitti et al. And it's titled "The Relationship to Childhood Abuse and Household Dysfunction to Many of the Leading Causes of Deaths in Adults." So like I was saying, this takes a look, and what they did is they sent out this questionnaire to, they sent it out to like 13,000 people, and 9,500 and some odd people replied. So these are people that were coming to the hospital for different chronic diseases. So they know they had chronic diseases. They wanted to see what was their lifestyle like. They gave them a list of about 7 different types of abuse or stressors that can happen to children growing up in households. And they wanted to see if you have a certain number of these, is there an area we know they have this many, then they're more likely to develop these habits, which leads to these chronic diseases and eventually an early death. And what they found was there's actually a huge correlation in this stuff. So you'll see that stuff here tonight. The childhood stressors that they went into were, one, they first asked, were you psychologically abused as a child? In your opinion, were you psychologically abused as a child? Were you physically abused as a child? Were you sexually abused as a child? Did you witness violence against your mother? Were you living with a substance abuser, whether that was drugs or alcohol or whatever it is? Did you live with someone who was an abuser of certain substances? Did you live with anyone were you exposed to people that were mentally ill or suicidal? And then finally, did you live with someone who was ever imprisoned, who had to go to prison for any reason, but they just went to prison? So they went through and they said yes or no to these 7 sections. And then they got all the 9,530 some of them, I think it was, back in, and they started to analyze the data from that, right? So what they found is that if you had 4 or more of these, then you were much more likely to experience certain things compared to people that had 0, right? What they found was you were 4 to 12 times more likely to become an alcoholic if you were exposed to 4 or more of those things that we talked about. When it came to drug use, you were 4 to 12 times more likely to be a chronic drug user, 4 to 12 times more likely to be depressed and suffer with depression, and then 4 to 12 times more likely to try to commit suicide from being exposed to these things, which those are big numbers. So you talk 4 times on the low end, that's bad odds, and just from being exposed to those. A couple more things they found, again, being exposed to 4, checking yes to 4 of those questions. They found that you're 2 to 4 times more likely to smoke, 2 to 4 times more likely to view yourself as unhealthy, 2 to 4 times more likely to have 50 or more sexual partners throughout your life, 50 or 2 to 4 times more likely to develop or contract an STD. And then you were 1.5 times more likely to become severely obese. Okay. And when you look at these things, it's no child comes out a smoker right in the beginning, or obese, or views themselves poorly, or wants to commit suicide, or depressed, or anything like that. These are habits that we form. And what this study shows is that the more we're exposed to stress and harmful environments as a child, the more likely we are to create those habits, which are leading to chronic disease and early death, right? Every one of these things on here can be associated to heart disease, cancer, diabetes, the obesity's on here. I mean, it's stroke, and we're dying earlier based off of our childhood experiences and the habits we later create, right? And I personally do not think that there's one person in the world who can't overcome their situation, right? I'm not saying it's easy, and I'm not judging for not doing it or anything like that, but it can be done, in my opinion, right? And according to this study, if you can do that, if you can overcome that stuff, you are much more likely to live a healthy life. Because the study went on to say the actual cause of death in these cancer, chronic drug users, the diabetes, heart disease, all that, the actual cause of death that we should be looking at is their lifestyle. And that was the conclusion of the study, is these lifestyle factors. Yes, you are more likely to develop them if you're exposed to them early on in childhood and the stress of childhood and things like that. But if we don't overcome them and replace our bad habits with good habits, we're going to get sicker and we're going to die faster. And that's what we're always talking about, is eat well, move well, think well. Right? If you look right now, the CDC, I'm sure most of you are familiar with the CDC just coming out and saying, when we go back and look at the 180,000 deaths we're attributing to COVID right now, or whatever it is, about 94% of them have underlying conditions that we're talking about tonight, comorbidities, right? Obesity being the worst one, but obesity, chronic disease in general, heart disease, cancer, diabetes, strokes, all that stuff. And that's 94%. That's why America has been hit the way they have by this virus right now. It's because we're terribly unhealthy, and we're the least healthy country in the world. When we look around the world, we've been hit the hardest because we're the least healthy. And we've got to get healthier. And that starts as a kid. That starts with what we're exposed to. But like I said, if you had a bad upbringing, so what? You go get healthy. Now's the time. Start taking care of yourself. And I don't mean to say so what to be brash in that situation, right? It sucks. It does. But if you want to live longer and you want to make changes, you got to do it. We got to start doing it, because we're unhealthy. And 94%, and when in that 94%, it wasn't like they had one underlying disease. On average, they had 2.6 comorbidities. Those are your chronic diseases like obesity and everything. And if you're obese, you were, I think, 46% more likely to die from the disease, 113% more likely to contract it, and you're going to be hit harder by it, because your body's just fighting so hard to try and survive that one little thing becomes the straw that broke the camel's back. Right? And I don't care what you call the death. It's sad either way, but I know it's coming from lifestyle. I 100% know it's coming from lifestyle and what we've created. And that's why in our office, what we do is we help educate patients on how to be healthier, live a healthier lifestyle. And we come into the office, right? It's $39 to see what's going on. How can we help you be healthier? Yeah, we deal with people in pain, but we get people all the time who come in and they take a health risk assessment. They see what their health score is, right? Come in, talk to the doctor, see what you're doing. Your $39 is a donation. It goes to the Wounded Warriors right now. You can write it off. We'll get you a receipt for that, but I don't care what the cost is or anything, or the donation. That doesn't bother me. What I want to do is help you get healthy, and I want you to make the decision for yourself and for your health to do that now, because it's that important. And there's going to be more viruses. There's going to be more bacteria. There's going to be more sickness in the world unless we get healthy and we're ready for it. So take advantage of this stuff, guys. Come and see us. Come and see us in McKinney. Come and see us in Lakewood. Reach out to me personally. Dr. P at txchealth.com. You can email me. You can reach out on Facebook Messenger. You can private message me, add me as a friend, whatever it takes. But let's get the word out there and let's get people healthy. And then what I want you to do is next week, we're going to be talking about omega-3s versus omega-6s. Please join us at 6 o'clock. And then along with this video, there will be a card showing you how to join us on Wednesdays at 12:30. We do a lunch talk for businesses in the community each week. So give us a call and we'll talk then. Thanks, guys.